Laikipia County Department of Health is set to get a new face in a move aimed at improving service delivery. This is after the cabinet approved its change from the Department of Health to Laikipia Health Services. 22 facilities will operate 24 hours throughout the week, while the dispensaries, which have been operating 5 days, will be operating 7 days per week. Our Laikipia correspondent Paul Moniki is joined by Chief Officer in charge for more details.
Thank you so much, Aaron. And as you have said, this is Laikipia County 031. And as you have mentioned there, it's like that the Laikipia Health Department is getting a major transformation. Just yesterday, that the cabinet, under the leadership of Laikipia Governor Delito Mureithi, approved the change of the whole department from a department, and it will now be referred to as Laikipia Health Services. And there is no other person who can be able to tell us more on this apart from the Chief Officer in charge of this department, Dr. Mogoi. Karibu sana, and maybe tell us what is this that is coming to Laikipia and maybe in the country for the first time at a county level.
Paul, thank you. My name is Dr. Mogoi Donald, the Chief Officer for the Department of Health. Yes, we are changing and transforming ourselves into Laikipia Health Service, specifically because we all provide the same service. We all want to have the same processes. We all want to have the same name. We want to have the same quality in terms of service. We want to reflect out there to our patients, to our clients, our customers who come to our health facilities and who seek our services, that we are one as a unit. And the reason for this is because we will be more efficient and we will be more effective in terms of how we are going to provide the services across our 84 outlets. Number two, we will also have synergies in terms of how we deploy our resources across the different levels of care or the different service provision levels. And then number three, we will also be able to deploy our human resource in a better manner across the levels. And we are also actually benchmarking and looking at what happens in the UK. If you go to the UK from the north all the way up to the south, when you get into a health facility, you feel like you're in the same facility that you are if you're in north or in south. So in Laikipia, we will want that all our facilities, all the way from Lonyek up to Nanyuki, to Nyaururu, to Rumuruti, to Doldol, that they'll reflect the same picture, they'll reflect the same service, they'll reflect the same level of courtesy, that they will reflect the same level in terms of efficiency and effectiveness of what they are delivering. Two, out of that, we will be able now to run our facilities that previously we've been calling dispensaries and health centers that were possibly running for 5 days. Now we'll be able to run them for 7 days, meaning we should be able now, out of the synergies that we're going to get out of us becoming one service, we will be able now to run those facilities for 7 days. Some facilities that were operating on an 8-hour basis now will operate on a 24-hour basis. Our two major hospitals that are providing level 5 kind of services will see quite massive investments and improvements in terms of the service levels that they provide, so that they can be able to help the younger or the smaller facilities or the outlets out there to be able to provide a 24-hour service or a 7-day kind of service. Yes.
And maybe Dr. Ali, tell us, the public are not aware of the services that you are offering at this level or at the level 2 or the level 5. What are these nitty-gritties that are going to change? We had that issues of specialists will be maybe visiting those dispensaries. How well prepared are you in this?
We are quite well prepared and quite well recharged for us to be able to implement that. You see, in any normal government facility or public facility in Kenya, a specialist will be in a level 5 or a level 4 facility. But what we want to do is that we have looked at our disease profiles, and we realize that there are patients or their clients who've got some diseases that they go seeking services at our lower facilities, the level 2s and level 3s. Now what we're going to do is to ensure that we've got a program where on a monthly basis, our medical officers, our specialists, or even sometimes our specialist clinical officers will be able to visit the level 2 and level 3 facilities to see these patients. We're going to organize these patients into groups. We are going to ensure that as they come in with those facilities also have got drugs that they can be able to refill for these patients instead of those patients having to travel long distances to come and get some of these services from the level 5 facilities. Yeah.
Thank you so much, Dr. Mogoi and Alan. As you have heard, this is a major transformation that is expected here in Laikipia, especially in the health sector. And we are going to look into it, and maybe other counties can come and compare after what the Dr. has said, that it is a pilot project that will be looked into keenly. From here in Laikipia County, back to you, studio. My name is Paul Moneki.